waist to hip ratio, waist divided by hip, and this is measured in inches. So this is measuring waist, and that is at 29 inches. And then to measure hips, over 37, 29 divided by 37 equals 0.78, and so my waist to hip ratio is 0.78. All right, so this is the correct anatomical position with palms facing outwards, looking forwards and everything, arms to the side. Some examples of anatomical terms would be the head is superior to the shoulders, or the shoulders are inferior to the head. Chest is anterior to your scapula, or scaps are posterior to your chest. Your sternum is medial compared to your shoulders, and your shoulders are lateral to your sternum. Your elbow is more proximal to your shoulder than, whereas your fingers are distal to your shoulder. And skin is superficial to your muscles, and your muscles would be deep compared to your skin. So the different planes of the body, frontal plane separates the body into anterior and posterior. So let's say this is a sheet going through my body this way. So if it was like this, anterior, posterior, sagittal goes straight through your body like this, separating your body into right and left. And transverse is like a square through here where you can rotate around. All right, so I'm going to use this tool to show the different axes of the body. The mediolateral axis runs horizontally side to side. So it'd be kind of going like this through my body, and it's perpendicular to the sagittal plane. The anterior-posterior axis runs horizontally front to back. So it'd be kind of cutting my body like this, and it's perpendicular to the frontal plane. And then the supero-inferior axis runs up and down, and it is perpendicular to the transverse plane. So it'd be kind of cutting through my body like this. And then to find your center of mass, it's where all the cardinal planes converge into one point. And so a good place where all of them converge would be where your belly button is. So now for some motions in the sagittal plane. This is flexion of the knee, extension of the knee, plantar flexion of the foot, dorsiflexion of the foot, and since I can't hyperextend my elbows or knees, we're just going to hyperextend a finger by forcing it to go back. And motions in the frontal plane, this is abduction. Adduction would be adding it back to your body, elevation of the scap, depression of the scap, eversion of the foot would be lifting your foot up like that. Inversion would be bringing it inwards like that. Ulnar deviation, for example, is going out like this. And lateral flexion would be like if you have a weight in your hand, you're going like this. All right, so motions in the transverse plane have to usually do with rotation. Rotation to the left, for example, going like this, rotation to the right. Internal rotation, like this. External rotation, out. Protraction, kind of looks like a turtle, like retraction, get some chins going. And pronation of the hands, like that. Supination, like holding a bowl of soup. Motions in multiple planes, circumduction, arm circles, like that. Pronation ankle would be putting your weight more on the insides of your feet, so it causes stress on your knees. Supination would be walking on the outsides of your feet. Okay, so a closed skill that is not used as an example would be a deep squat, for example. So, an open skill would be swinging a baseball bat and hitting the baseball, because not every single throw is the exact same coming at you. A simple and complex kinetic chain. In a simple kinetic chain, each segment participates in no more than 2 linkages. So an arm, for example, is a simple kinetic chain. Complex kinetic chain, segment is linked to more than 2 segments. So torso, for example, it's connected to a lot of things. And then a open kinetic chain versus a closed kinetic chain. Open kinetic chain would be distal segment is free to move. So bicep curl, for example, because this is the distal, just free to move all around. Closed connect chain is the distal segment has to remain stationary. So for example, a push-up would be, see, look, distal has to stay on the floor, cannot physically move. All right, so motion is a change in position with respect to spatial and temporal frames reference. Translation is known as linear motion, and it's a motion along one of the axes, so the X, Y, or Z axis, and it's moving in the same direction, same time. Two types of translation are rectilinear translation, which is path of the system is in a straight line. And there's curvilinear translation, where the path is in a curved line. And then we have rotation, which occurs when a system is forced to move around a fixed point, which causes a circular path. And then general motion is just a combination of rotation and translation together, and most human movement is general motion. All right, so for the different types of skills, we have discrete skill, which is a movement with a definite beginning and end point. So an example of this would be high jump, because you start in one spot and then you end on the mat every time. You have a continuous skill, which is cycles of repeating movement. So for example, running would be a continuous skill. All right, then we have a serial skill, which is a movement that appears to be continuous, but it's really a combination of a bunch of discrete motions. So an example of this would be doing the vault in gymnastics.